Hi everyone, it's Don from the MS Guide. Today I'm joined by two pretty incredible guests, and we're going to talk about something that blokes don't like to talk about generally. You know, we don't even talk about it that much with our friends, to be frank. We're going to talk about sex, and we're going to talk about sex as it pertains to men, and we're going to talk about sex as it pertains to men with MS. And I have with me today two special guests. We're going to start that video right now. Hey, Brian. Hey, Aaron. I think many of you will know Dr. Aaron Boster, and Brian is on Twitter as MS Awareness. Brian is an ex-Marine who's been in Afghanistan and Iraq, and I just thought this is pretty cool. Even though he's got pink hair, it shows that we all can get MS or get affected by it. But guys, I'm going to turn it over to you to introduce yourselves. If you could tell us a little bit. Aaron, if you go first.
With pleasure. Dom, howdy do. Thank you so much for having me. I've been excited to talk with the two of you all week. My name's Aaron Boster, and as always, thank you for learning about MS with me. I'm an MS neurologist in Midwestern United States in Ohio. I have a YouTube channel, and I am delighted to be here with you.
Fantastic. Brian.
Hello, I'm Brian from down in Florida. I have had MS for about 4 years now. So still, even though I know a lot, still learning about, more stuff, stuff as you go, because you always got to learn. But yeah, that's a little bit about me.
Yeah. Hey, guys, thank you. And I appreciate the effort that you both made to get here, because it's just all the time zones and the messing around and stuff. So it's, guys, I was just wanted to talk, and we've got Aaron here to sort of inject some, should we say, common sense into some of this. But personally, I'll go first. I'll make the admission. I can only do it in the evenings, really. I'm not a morning guy. I'm not an afternoon guy. I'd love to be. And I kind of got to plan it with pills if that's going to be the case. And I'm very fortunately married so that my wife understands, and we've talked about it. But it's just one of those things. I don't know. How does it affect you, Brian?
And I'm only in the evenings as well. My wife works. Now I say we're the perfect couple. She has fibromyalgia, so she deals with that. I deal with the MS. At first I was kind of, even though we were married, it was kind of one of those things, but finally broached the subject, of, hey, let's have that moment like you see on the thing. Unfortunately, because I have a lower blood pressure, I can't take the pills, so it's kind of like, for lack of a better saying, is it going to work or is it not going to work? So, sometimes it does, sometimes it doesn't. Sometimes I'm like, okay, let's go really quick, not to say,
Sure.
You both touched on something which is critically important. I just want to call it out really quickly. Both of you shared that you communicated with your partner. And that is arguably such an important thing that most guys ignore. So we may spend every waking moment nervous about the inability to get an erection adequate for vaginal penetration. All right. And that has nothing to do with having MS. That's being a guy over 40. Let's be honest. And we may be nervous about it, and it may consume our fears and our minds. And we've never spoken to our significant other. And you both gave examples where you said, look, I've identified a situation, talked to my significant other. We worked out a plan. And I just want to call that out because that is key to success. And so many guys never take that step.
I think it's really hard because you go for your appointments, and especially if you're chatting with the nurse and they're going, and is there anything else you want to tell me? And you're thinking, not to you. No, I definitely don't want to talk to you about this. And I also want to make the other point, Aaron, you said vaginal penetration. That's kind of some of us, but not all of us. And
and you know what? Shame on me. Yep, shame on me.
I'm not trying to shame, but I just think we have to remember that what's the ordinary for perhaps us is not that way for everybody. So
no, you're spot on, and I do say shame on me. I'm heterosexual, and I knee jerk to that reaction. But you're right. Lots of people enjoy a lot of different things, and the goal with MS care in general is to live your best life, and that includes the bedroom. And so whatever you like to do in the bedroom or the carport or wherever, the goal is we want to make sure that it can be a successful, fantastic moment. Yeah. And there's lots of ways of making that a reality. But again, it starts with talking about it, which is what we're doing. Look at us.
Yeah. Hey, Brian, can I ask you, have you ever spoken to any of your friends about this?
No.
No, no,
You know, e- even
exactly.
even my best friends that I've known for over 20 years, it's, I've talked about everything about MS and how it affects me, except the sex part. Because, especially with guys, you don't want to be like, hey, I gotta, have a problem getting an erection. It's one of those things. It's the guy things, So you fake it, you fake it. You're like, yeah, yeah.
I mean, I think with the advent of Viagra, we all think that now you can essentially, and excuse the British Mickey taking here, we call them wood pills, but it's just, I mean, whatever way, that little blue pill, nudge, nudge, ring, ring, and then you say, Brian, can't take it. I had no idea.
Yep, because I have the lower blood pressure because, and not to, I know it's a different subject, but they first tried it with with my urinary problems, but because it's not low, but because it's lower, when I took them, I was just getting lightheaded and the imbalance was getting even worse. So me taking the pills was worse for me than not taking the pills. So unfortunately, like they say a lot, you gotta deal with it. It is what it is.
So there are options to explore beyond pills, and if you haven't yet seen a urologist with a bend towards multiple sclerosis, that may be life changing. And the reason I say that is a lot of guys, you're not alone in not being able to tolerate a Viagra or a Cialis, and there are other things. There are penile pumps, there are injections, there are a plethora of other tools that can be used. One of the things that I've started to do in my clinic with my gentlemen that have MS is start to check their testosterone, because what I've discovered is plenty of guys have remarkably low testosterone. And not only is it causing problems in the bedroom, but there's other MS problems that can arise. I guess my point is I'm begging you to go see a urologist, because you'll walk away from that visit like really excited.
Yeah. Now I did see a urologist, but maybe they don't have the MS experience. So maybe I can go to urologist, see if they have that, MS experience
That's a really good point. And you want to say, hey, do you care for MS patients? And if he says, yeah, I've done surgery on one. That's not what we're talking about. We want someone that's going to get into the weeds with you and figure out the details, the mechanics of sex to make it better.
Yes.
Aaron, can I ask you, how, when you get people like us in, or I mean, you get a whole range of people in, how do you start the topic, and what do you wish that people would like do or release, or I don't know, how do you?
So Dom, I start the relationship by talking about sex casually with the family, not inappropriately, but I try to make it very well known that I will discuss sex. So during my initial intake interviews I do with families or with a patient, I'll say any difficulties with down there is bowel difficulty, bladder difficulty, bedroom difficulty, and I'll take extra steps. Are we talking about obtaining an erection, maintaining an erection, ejaculating? Where is the difficulties? And so, and I will revisit these comments almost with every visit. So what I'm trying to do is I'm trying to tell the person listening, hey, look, man, this is not a taboo topic for me. And if you would like to discuss it, I'm game, And so it's my hope that by doing that, people feel a little more comfortable. Really, we don't have a lot of time in clinic, right? I take a half an hour for a clinic visit, and that's a jam-packed moment. And so what do I want? I want you to come straight out and say it. I can't get an erection. I haven't been able to ejaculate in 3 weeks, or whatever the case may be, because if we identify that as an issue, we're going to tackle it that clinic visit. So really, I just want people to recognize that I'm on their team. I'm on team. Let's give you an erection, and we're going to work together to figure out how to do that. You just got to tell me that it's an issue.
You need to get a bumper sticker for that, I'm sure.
That would be really funny.
Yeah, I mean, how do people react to testosterone? I mean, I think it makes you laugh when you think, oh, I'm just rubbing on manliness, and am I going to sprout extra hair and go running around slathering at women? But what happens when you take testosterone?
So the first thing is to clarify that men with MS who have a low testosterone can have, beyond difficulty in the bedroom, they can have difficulty with thinking and memory and progression of disability faster than what's normal. And that almost sounds like a bad joke, except that's real. And so when you supplement testosterone in a gentleman with a low testosterone, they don't turn into an incredible Hulk and rip the car door open. What happens is they think more clearly. They perform better in the bedroom, and their disease slows down. So it's normalizing something that's deficient. And so it's been a good experience for me. Now, I oftentimes grab the assistance of a urologist because they're super smart in this area. And so they'll follow the levels and adjust. But it's an element of sexuality in MS with men that is oftentimes ignored. And so I hope that some guy listening to us right now thinks, I'm going to ask my doctor to check my testosterone level, because he may end up with a much better situation.
So how do they do it? Brian, have you ever had yours checked? I haven't.
No, I mean, I just learned about that today. I got an appointment in a couple months ago. Like, hey, that's something I need to ask about. So I even what are they doing there?
So a real quick in service, you want to check a morning testosterone, because testosterone is the highest in the morning. So if you have a low level in the morning, at least American Insurance will recognize that. If you take an afternoon level, they'll toss it because it's lower in the afternoon anyways. So you take a morning level, and typically you have to have 2 levels that are low. And so for me, anything less than 400 really bothers me for my patients. And so we check.
Aaron, is it blood? Is it?
It's blood. It's a blood test. It's a simple blood test. You get it with all the rest of your blood that day, and then the level comes back, and I get a total testosterone. If it's under 400 and you have symptoms, we're on, and we're going to tackle that. It's something that I feel guilty about not having done routinely earlier in my days of practice. And it's only been the last maybe 5-7 years that I've really started to pay more attention and really try to watch. And I'll tell you, you'll be shocked. You'll find a gentleman and his testosterone is rock bottom low. And then you start to realize, well, maybe that's why he's having some of these difficulties.
Can you tell by looking, shall we say, can you say, well, that person looks beat up and their testosterone is low, or he's running around like a lunatic, it must be high?
Nope, not at all. No, it's not like the big beefy man has a high testosterone and the little tiny man doesn't.
Right.
Not at all. Yeah. So this is, there's so many other aspects of sex that are important, but this is one that I think shouldn't be ignored in the MS space. I really don't.
I mean, one of the things, and we all seized on it right away, I think, is communication. I mean, I was very fortunate. I was raised, my mom, I mean, it made us cringe as kids, but she was going to explain sex to us, and there was going to be no taboos and everything. But I think a lot of people, it can be harder to, should we say, generate the initial conversation about, and I mean, we'll merrily talk about penetration, erections and stuff. And some people, are just going, would you shut up?
Well, it's funny. When I first onboarded one of my nurse practitioners, a wonderful gal that I worked with for many years, and she was rather timid and quiet and shy. And so she would turn bright red when we would talk about sex with patients. I mean, I would turn around and she was like beet red, so it is a delicate topic, but it is so important. And here's the thing, guys, if you want to improve the quality of an adult's life, allow them to eat well and have good sex. If they can do those 2 things, most humans are pretty okay, like honestly. So when we're trying to improve the quality of your life, I want to make the bedroom and the kitchen table fantastic for you, right? And so that's not to be underappreciated. If we make your disease slow and you're not having attacks and you're not progressing and you can't get an erection, you're not going to be a very happy camper. Like, and I did want to make sure that we talk, it's not just about primary sexual dysfunction, meaning like the circuitry of sex is messed up. There can be secondary sexual dysfunction where you have symptoms that make it not sexy. For example, losing your bladder during intercourse, or having a spasm of your leg, or having neuropathic pain where a light touch that is intended to feel good hurts. Yeah. And so if we identify that, say, let's use spasticity as an example, Dom, that during intercourse, particularly during the flying Lawinda that your spouse is very excited about, that weird position where, that causes spasms, then we need to do a couple things. We need to talk about other positions, and we need to pre-treat. We need to stretch like you're going to go to track practice. And we need to, no, I'm serious. And we may even need to take baclofen before intercourse so that you're not having spasms during sex. I mean, we have to game this stuff out. And in the same way that you would game out any other activity, I bet you that before you go climbing or walking, you have a routine to get your body ready and your head ready. And this is the same behavior that we'll use in the bedroom.
Because I'm old. I don't know. I mean, Brian, do you have to stretch every day? I mean, I have to stretch every day because I'm old, I think, not because I've got MS. But I mean, Brian, do you have a routine for anything, for sex, for getting up, for whatever?
I do stretching and everything. And what has helped me actually a lot, believe it or not, is just recently I started going to a chiropractor.
Nice.
But when I first started going to, I always thought of the chiropractor, okay, they're going to make my bones crack and I'm going to be good. But this one here has exercise machines, and I'm like, yeah, but I can really do that. But I've learned so much about this stuff. Like I do stuff like it's on low, but it like I've gone to where I've been in a lot of pain and everything else and done this stuff, and it hurts really much when I do it. But afterwards, I'm like, I feel better just because, you see the exercise machine. You're just like, okay, people are doing that to get strong, but you can use those things to like stretch your body.
I'm just wondering if any of the stuff that you do with your chiropractor essentially makes you more of a love god.
I bet it does. I bet it does.
It does, because like I said, even though I do it like in the morning, like I feel better at nighttime, because I mean that's the time. And and I like the morning because I like to get stuff done and be done with the day. It's not even from the chiropractor, because I go to the VA, of course, I'm a veteran, but I knew someone who works at this thing, and she was like, come here. She was like, come here.
Maybe you can schedule a morning chiropractic session when there's a high likelihood that your wife will acquiesce in the evening, right? So she can be planful.
Yeah.
Hey guys, look, I appreciate you coming on. I know we've all got busy days, and I think the main thing to focus on, we were talking about this, we nailed it really. It's communication. And if it's not working on the day, if you both understand what's going on, as has happened in the past in the Shadbolt household, it's like, do you know what, everyone? Good effort. Let's go get a cup of tea, and because things just aren't happening today. And then we'll do it again. But as opposed to going, oh my God, I'm going to die, it's so shameful.
Say, you know what? Let's hang out and watch TV. One of my favorite comments from a gentleman who has erectile dysfunction, rather severe. And when this happened to him after an attack, and he came to his wife and he said, look, here's the situation that I'm in. And she said, does your mouth still work? And that made him feel better, because what she was saying to him was, we can still be intimate, and you can still pleasure me, and I can still pleasure you, and that's okay. And that one comment made him feel all right. And I thought that was an awesome comment, an awesome story.
Yeah, it's kind of like you get worried, and then you find that you're forgiven by your other half, and then it's like, actually, there was nothing to be forgiven for, but everything's cool. Guys, I really, really appreciate your time. Brian, Aaron, I know it's different time zones. Just so everyone knows, I will put links in the description. So Aaron, your website, Brian, your Twitter feed, all these good things. So if anybody wants to find this stuff, it'll be in the video description. And also, I'd really appreciate it if you like and subscribe. We all know how this goes. So it's, guys, until next time, have a really great day.
And gentlemen, let's have an awesome night.
Yeah, there we go. Good planning. All right. Thanks a lot, Aaron. Thanks, Brian.
Take care. Bye-bye, guys.
Bye.